Health, one of the most important things in our lives since we born and until we pass away. To stay good and stable, you need to have a nice health system to support you. This care can be offered by the government or be private and it all changes from each country. At today's documentary, we are going to talk more about the World Health System and its particularities, challenges, and ranking.
The World Health Organization is releasing a list of urgent global health challenges. This list reflects a deep concern that leaders are failing to invest enough resources in core health priorities and systems. This puts lives, livelihoods, and economies in jeopardy. None of these issues are simple to address, but they are within reach. Public health is ultimately a political choice.
We need to realize that health is an investment in the future. This means advocating for national funding to address gaps in health system and health infrastructure, as well as providing support to the most vulnerable countries. Investing now, you save lives and money later. The cost of doing nothing is one we cannot afford. Governments, communities, and international agencies must work together to achieve these critical goals. There are no shortcuts to a healthier world. 2030 is fast approaching, and we must hold our leaders accountable for their commitments.
The climate crisis is a health crisis. Air pollution kills an estimated 7 million people every year, while climate change causes more extreme weather events, exacerbates malnutrition, and fuels the spread to infectious disease such as malaria. The same emissions that cause global warming and responsible for more than 1/4 of deaths from heart attack, stroke, lung cancer, and chronic respiratory disease. Leaders in both the public and private sectors must work together to clean up our air and mitigate the health impacts for climate change.
About 1/3 of the world's people lack access to medicines, vaccines, diagnostic tools, and other essential health products. Low access to quality health products threatens health and lives, which can both endanger patients and full drug resistance. Medicines and other health products are the second largest expenditure for most health systems after health workers, and the largest component of private health expenditure in low and middle income countries.
Lack of food, unsafe food, and unhealthy diets are responsible for almost 1/3 of today's global disease burden. Hunger and food insecurity continue to plague millions, with food shortages being perniciously exploited as weapons of war. At the same time as people consume foods and drinks high in sugar, saturated fat, trans fat, and salt, overeating, obesity, and diet-related disease are on the rise globally. Meanwhile, tobacco is declining in a few but rising in most countries, and evidence is building about the health risks of e-cigarettes.
In about 1 in 4 health facilities worldwide, there is a lack of basic water services. Water, sanitation, and hygiene services are critical to a functioning health system. The lack of these basics in health facilities leads to a poor quality care and increased chance of infection for patients and health workers. All of this is happening against a backdrop of billions of people around the world living in communities without safe water to drink or adequate sanitation services, both of which are major drivers of disease.
Every year, the world spends far more responding to disease outbreaks, natural disasters, and other health emergencies than it does preparing for and preventing them. A pandemic of a new highly infectious airborne virus, most likely a strain of influenza, to which most people lack immunity, is inevitable. It is not a matter of if another pandemic will strike, but when it strikes, it will spread fast, potentially threatening millions of lives. Meanwhile, vector-borne diseases like dengue, malaria, Zika, chikungunya, and yellow fever are spreading as a mosquito pollutions move into new areas, fined by climate change.
Access to health is one of the basic needs of the citizens that the government has the duty to provide. In each country, the health system works differently. For example, although it's not a wonder, here in Brazil we have the SUS, Unified Health System, which is maintained by the federal government and offers various types of medical care and exams, completely free of charge.
The quality and efficiency of a country's healthcare system can have a massive impact on its inhabitants' quality of life. The health of a nation depends largely on how the system can cater for their people, which is why a good public health care system is so important.
Denmark, Sweden, and Canada are the top three of the best healthcare systems in the world. The Danish Universal Healthcare System provides Danes with mostly free medical care and is predominantly financed through income tax. All permanent residents are entitled to a national health insurance card, and most examinations and treatments are free of charge.
The Swedish healthcare system is characterized by high standards of quality care and above-average healthcare spending. Only about 600,000 Swedes have a private health plan, which is usually covered by their employers and can be helpful to skip queues for treatment.
Canada's publicly funded healthcare system is a group of socialized health insurance plans providing coverage to all Canadian citizens and permanent residents. Canada holds a remarkably high life expectancy rate, which many attribute the efficiency of its healthcare system.
Sierra Leone, Myanmar, and the Central African Republic are the worst countries with an universal public health system. The Sierra Leone nation is an example of dependence on charity. 60% of public spending is covered by foreign government and non-governmental organizations. In addition, the public health system is a disaster and the government is unstable.
Health indicators in Myanmar have begun to improve as spending continues to increase. Both public and private hospitals are understaffed due to a national shortage of doctors and nurses. Public hospitals lack many of the basic facilities and equipment.
In the Central African Republic, mobile crews treat local epidemic disease, conduct vaccination and inoculation campaigns, and enforce local health regulations. They conduct research on sleeping sickness, malaria and other tropical diseases and devise prophylactic methods best suited to the rural population. In 2004, It was estimated that there were fewer than 3 physicians and 9 nurses per 100,000 people. The health system, already weakened, is now collapsing.
Countries that don't have public health system. United States of America. There is no free health system in the country. Every American citizen must have private health insurance in case they need medical attention. Even so, it is not enough to have money to pay for the plan. There is a list of restrictions that cause many insurance to be denied in the country. The list of restrictions can limit even the attendance of people who already are insured.
In Australia, there is a partnership between public and private medical care. Therefore, health is not free. With Medicare leave, a percentage of the citizen's salary must be set aside to cover medical expenses. For this reason, some people prefer to hire a private health plan.
Payment of health insurance in the Netherlands is mandatory. All Dutch and foreigners living in the country must pay for health care. There is no universal health care, but in practice, it works like the health insurance model that is known in countries like Brazil, with the difference that it is mandatory to hire, even if it is a more basic plan.
In Germany, there is no public medical care. All citizens of the country must pay for health insurance, whether government or private. Thus, there is no hospital or public emergency room to which the traveler can be directed. If you are not covered by local health insurance or Germany travel insurance, the traveler must be referred for private assistance, for which he or she will pay very high fees for assistance.
Israel. The Israeli model of health is very similar to the German one, since citizens must purchase one of the 4 private health insurances in the country. Although all Israeli residents are entitled to basic health care as fundamental right, protection must be contracted.
Switzerland is one of the countries where there is no public medical care. In the country, every citizen must pay for medical care and health procedures. Although the health market is regulated by the government, there is no public health structure. Thus, each citizen must pay for medical costs, which may be higher or lower, according to the amount of the deductible to be paid for each service used.
If the Asia country is your destination, you need to know that there is no health system, but that the country is in process of change, and in the coming years this can be changed. The health system in India is restricted to the tallest pills and very residents. For not having a regular situation, it may be denied service. In addition, in India there is no network of public hospitals, and care is the responsibility of each state.
Brazil is the only country in the world with more than 200 million inhabitants which has a public health system. Some countries are reorganized internationally for having a public health system. However, countries like United Kingdom, Canada, Denmark, Spain, Portugal, and Cuba do not have a population of more than 100 million inhabitants. In practice, these countries do not have a public universal health system such as SUS.
The Ministry of Health contested the methodology of the World Health Organization that determined the 150 position in the ranking of health systems in the world. This is the first time that the World Health Organization has carried out a study on health issues of 191 countries.
In this work, several points of the health networks were evaluated according to their effectiveness, cost per inhabitants, equity in healthy finance, and training to promote social justice. Another point raised in the study was the simultaneous attendance of doctors in the public and private network, which means a subside from the public sector to the private sector, with a natural drop in the capacity and quality of the public service. In the matter of health expenses, Brazil ranks 54th.
Above all, each country has to look after their health systems to be able to support the population in case of need. We all have to understand that there are people dying as a consequence of a poor health system, and if we let it aside, the situation is going to get worse. We hope that this documentary has shown you how the World Health works and the high difference place to place.